pain in the lower back, buttocks, and back of the thigh that worsens while sitting, standing, and walking can be caused by problems with the piriformis muscle. A spasmodic piriformis muscle impinges on the sciatic nerve, as well as other vessels and nerves passing through the greater sciatic foramen. This can result in pain in the lower leg and foot, swelling of the affected limb, sexual dysfunction, and pain in the external genitalia and rectum. In the first part of this video, I discussed trigger point locations, referred pain zones, and helpful recommendations for relieving discomfort. In the second part of the video, I've prepared a 10-minute set of simple exercises that will help relieve tension in the piriformis muscle and get rid of pain at home. I'm Dr. Chernov. Enjoy watching. The piriformis muscle attaches at one end to the front surface of the sacrum and at the other end to the femur. It exits the pelvis through the greater sciatic foramen, where the sciatic nerve also passes. The upper gluteal vessels and nerve, the pudendal vessels and nerve, the inferior gluteal nerve, the posterior cutaneous nerve of the thigh, as well as the nerves that go to other nearby muscles. The shape and size of the piriformis muscle can vary among different people. In the overwhelming majority of cases, it is wide and massive, while in some, it is thin and small. When the piriformis muscle is massive and fills all the space of the greater sciatic foramen, it can compress the vessels and nerves. It negatively affects the innervation and blood supply, not only to the entire leg, but also to the buttock area and the front part of the perineum. Prolonged compression of the gluteal nerves and vessels can lead to atrophy of the gluteal muscles and a decrease in their volume. Involvement of the piriformis muscle by trigger points leads to pain primarily in the area of the sacroiliac joint, the buttocks, behind the hip joint, as well as in the upper part of the back of the thigh. Pain from nerve compression is different from myofascial pain that comes from trigger points. However, very often both of these conditions occur simultaneously. Pain from sciatic nerve compression can radiate further than pain from trigger points in the piriformis muscle, and it radiates to the lower leg, as well as to the sole of the foot. A tense piriformis muscle can often displace the sacroiliac joint and significantly contribute to pelvic tilt. Activation of trigger points in the piriformis muscle can occur as a result of any unusual loads. For example, when trying to prevent a fall. Deviations to the side when bending or rapid rotation of the leg can also cause acute overload. Muscles, prolonged sitting on a hard surface. Prolonged driving or direct trauma to the area of the gluteus maximus muscle can also trigger the activation of trigger points in the piriformis muscle, leading to characteristic pain. The pain worsens when getting up seated and walking. Exhausting sports activities such as running, playing soccer, basketball, or tennis can significantly overload the piriformis muscle. The piriformis syndrome can be accompanied by both pain and sensory disturbances. For example, a burning and tingling sensation in the lower back, in the groin, perineum, buttock, hip joint, along the back of the thigh, calf, and foot. In addition, swelling of the affected limb, sexual disorders, tenderness in the area of the external genitalia, and impotence in men may occur. It is commonly believed that three components contribute to the development of piriformis syndrome. The first is myofascial pain originating from trigger points in the piriformis muscle. Second component is nerve and vessel compression in sciatic foramen. And the third is the displacement and dysfunction of the sacroiliac joint, when persistent tension in the muscle leads to the misalignment of the sacroiliac joint and joint dysfunction. It maintains prolonged tension in the piriformis muscle. In a seated position, a person with piriformis syndrome usually fidgets and often changes their posture. They may often have difficulty trying to cross the affected leg over the healthy one. In a lying position on the back, relaxed, one can see a persistent external rotation of the thigh on the affected leg. When trying to lift the straightened leg, there is a noticeable limitation in this ability slightly on the affected side. If you place your hands on the patient's knees and ask them to spread their legs, weakness will be noted on the affected side. Muscles, pain, and trembling in the leg. There are 4 variations of how parts of the sciatic nerve exit the pelvic cavity. In the first case, the sciatic nerve passes in front of the piriformis muscle, between the muscle and the edge of the greater sciatic notch. This is the most common variation, typically occurring in 85% of cases. In the second case, the fibular part of the sciatic nerve passes through the piriformis muscle, and the tibial part of the sciatic nerve is located in front of the muscle. Third variation, the fibular part of the sciatic nerve loops over the top, and then goes behind the piriformis muscle, while the tibial part of the sciatic nerve is located in front of the muscle. In 1% of cases, the sciatic nerve passes through the piriformis muscle. It is important to note that the most common initial variation often leads to the compression of the sciatic nerve. Compresses the sciatic nerve due to bony edges and ligaments exerting more pressure than muscle bundles. To eliminate trigger points in the piriformis muscle, relieve its spasm, and unblock the sciatic nerve, it's necessary to apply mechanical pressure to the muscle, followed by stretching it. Take a small massage ball or a tennis ball and lie down on the floor. Place it under the area of your buttock and apply pressure for a few minutes. Massage pressure on the gluteus maximus and the piriformis muscle lying underneath it. Move your pelvis, first to the right and left, then forward and backward, and then in a clockwise and counterclockwise direction. If there are trigger points in the piriformis muscle, you'll feel significant tenderness in that area. Find the most painful spot, stop and press on it for 30 seconds. For even more intense mechanical pressure on the piriformis muscle, place your leg on your knee, the second leg. Make sure to repeat this exercise on the other side. After that, stretch the piriformis muscle. Since the main function of the piriformis muscle is hip external rotation, you can stretch it using hip internal rotation. The simplest exercise is simply lying on your back. Bend the affected leg at the hip joint and place the foot on the knee of the straight leg. Grab the knee of the bent leg with the opposite hand and pull the leg towards the floor. Hold the final position for 1 to 3 minutes, maintaining deep and smooth breathing. This position, in addition to stretching the piriformis muscle, can be used for self-mobilization of the sacroiliac joint, which is characterized by a clicking sound. After stretching the muscle, it's important to perform a few active movements that engage the piriformis muscle. Repeat the exercise on the other leg. For an even more intense piriformis stretch, place the shin of one leg near the knee of the opposite leg, bend your leg and wrap your hands around your thigh. Gently bring your legs closer to your torso and feel the stretch in the muscles. Hold the final position for a few minutes and then repeat the exercise on the other leg. A more complex but very effective exercise for stretching both piriformis muscles is the following. Bend one leg at a 90-degree angle at the knee and place the second leg on top. Try to bring your legs closer together while keeping your back straight. You need to be very careful with the load to avoid injuring your knee joints. After holding the final position for a few minutes, switch legs and repeat the exercise on the other side. With piriformis syndrome and sciatic nerve compression, you can perform these exercises in isolation, but it's best to do a set of exercises. It is necessary to eliminate functional scoliosis caused by unequal leg lengths or a reduction in the size of one half of the pelvis. Avoid prolonged static loads. For example, when sleeping on your side, it's important to place a pillow between your legs to avoid prolonged stretching of the piriformis muscle. When sitting in a car seat or at a computer, it's important to pay attention to your posture. Don't throw one leg over the other and don't sit on one leg. Take frequent breaks at work by doing self-massage of the piriformis area, stretching exercises, or just a short walk. When exercising, don't overload the muscles in the gluteal area.
It's important to note that piriformis muscle damage rarely presents as an isolated syndrome. Very often, the pathological process involves 5 other short muscles that perform external rotation of the hip, as well as the gluteus maximus, gluteus medius, and gluteus minimus. You can find detailed reviews of these and other muscles in this playlist. I would be happy if you share this video with your friends who suffer from issues with the piriformis muscle and sciatic nerve compression. In the second part of the video, you will find a 10-minute set of simple exercises that will help relieve tension from the piriformis muscle and get rid of pain at home.
Sit on the mat and leaning on your hands, carefully lie down on your back. Bend your legs at the knee joints at an angle of 90 degrees. Take your hands to the sides behind your head and stretch them back. Take a smooth inhale through your nose and slowly lift your pelvis up. The feet are at the width of the pelvis. Exhale slowly through your nose and lower your pelvis to the floor. With the next inhale, lift your pelvis off the floor again and lift it even higher, actively engaging the gluteus maximus muscles. With an exhale, lower your pelvis down and completely relax the muscles. Repeat this exercise one more time. Again, take a smooth inhale through your nose and lift your pelvis as high as possible. Fix this position for 30 seconds. Breathe smoothly through your nose and actively tense the gluteus maximus muscles and the muscles of the lower back. Lower your pelvis to the floor. Bend your legs at the hip joints. Bring them closer to your body and grab your shins with your hands. Hold this position for 30 seconds and maintain deep breathing through your nose. Straighten your left leg and place it on the floor. Bring your right leg even closer to your body. Pull your toes away from you. Breathe smoothly and deeply through your nose. Hold the position for 30 seconds. Straighten your right leg and place it on the floor, and bend your left leg at the hip and knee joints. Grab your shin with your hands and bring it closer to your body. Fix the final position for 30 seconds. Straighten your left leg and place it on the floor. Bend your right leg at the hip and knee joints. Move your pelvis to the right by 1 to 2 centimeters. Place the foot of your right leg on the knee of your left leg. Grasp the knee of your right leg with your left hand and lower it to the floor. Hold this position for 30 seconds. Look at your right hand. Breathe smoothly and deeply through your nose. The shoulder joint and shoulder blade of your right arm are pressed to the floor. Feel a gentle stretch in the muscles of the lower back and gluteal region. With each exhalation, try to lower your right leg even lower. Slowly return to the starting position, bend your left leg and straighten your right. Move your pelvis 1 to 2 centimeters to the left. Place the foot of your left leg on the knee of your right leg. Grasp the bent leg with your right hand and lower the knee closer to the floor. Place your straight left arm at shoulder level. Hold this position for 30 seconds. Look at your left hand. Breathe smoothly and deeply through your nose. Slowly return to the starting position. Bend both legs. Smoothly turn around and go to the all fours position. Place your feet shoulder width apart, knees hip width apart, and bring your big toes together. Exhale slowly through your nose and smoothly lower your pelvis to your heels, stretching your back muscles. Inhale slowly through your nose. Move your body forward, slightly arch your spine and look up. Exhale slowly through your nose and again move your pelvis to your heels, trying to lower it even lower and if possible touch your forehead to the floor. Inhale slowly and move your body forward, arching your spine a little more. Repeat these movements one more cycle. With the next exhalation, lower your pelvis to your heels and fix the final position for 30 seconds. Breathe smoothly through your nose and feel the stretch in your back and arm muscles. Inhale smoothly through your nose. Move your body forward and carefully perform the arch. Hold this position for 30 seconds and avoid putting strain on your lumbar spine. Slowly return to the starting position. Sit on the mat. Straighten your left leg and bend your right. Place the foot of your right leg behind your left knee. Grasp the bent leg with your hands. Inhale slowly. Push your lower back forward and stretch the crown of your head upward. Intercept your right leg with your left hand. Exhale slowly through your nose. Turn your body and head to the right and hold the final position for 30 seconds. Smoothly return to the starting position and straighten your right leg. Bend your left leg. Place the foot of your right leg behind your left knee. Grasp the bent leg with your hands. Inhale slowly. Push your lower back forward and stretch the crown of your head upward. Intercept your left leg with your right hand. Exhale slowly through your nose. Turn to the left and hold the final position for 30 seconds. Slowly return to the starting position. Straighten your left leg, move your pelvis closer to the front edge of the mat, and carefully lie on your back. Straighten your left leg, bend your right leg, and place the heel of your right leg next to your left knee. Bend your left leg and clasp your left thigh with your hands. Hold the position for 30 seconds. Breathe smoothly through your nose, and with each exhalation, try to bring your legs even closer to your body. Feel the stretch in your piriformis and gluteal muscles. Smoothly return to the starting position and straighten your right leg. Bend your left leg and place the heel of your left leg next to your right knee. Bend your right leg and clasp your right thigh with your hands. Hold the final position for 30 seconds and try to gradually bring your legs closer to your body. Slowly return to the starting position. Lower your legs to the floor. Sit down and bend your legs at the knees at a 90-degree angle. Take your hands behind your back and place your hands at the width of your shoulders, fingers pointing back. Inhale slowly through your nose and smoothly lift your pelvis up, engaging your gluteal muscles and back muscles. Exhale slowly, lower your pelvis, and relax your muscles. With the next inhalation, direct your pelvis up again. trying to lift it even higher. With an exhalation, lower your pelvis to the floor and release the load. Inhale smoothly through your nose again, lift your pelvis, and hold the final position for 20 seconds. Slowly lower your pelvis to the mat and straighten your legs. Lean on your hands, fix your pelvis with your hands, and stretch your lumbar spine. Place your body and head on the mat. Move your hands behind your head and stretch your arms back strongly. Lower your arms to the level of your shoulder joints or even lower and completely relax for a few minutes.
Perform this complex daily and get rid of problems with the piriformis muscle, pinched sciatic nerve, and lower back pain. I highly recommend watching this video about the gluteus medius and minimus, which are often affected by trigger points along with the piriformis muscle. Stay healthy.